Welcome to the deep dive. Today, we're tackling a really important topic for pretty much any dog owner or really anyone interested in animal health: canine heartworm disease.
Hmm.
It's something, many of us have heard bits and pieces about, but we want to go deeper than just the basics today.
Absolutely. Yeah. The goal for this deep dive is really to unpack what heartworm disease actually is, how it affects dogs internally, and maybe most importantly, what we can actually do about it.
And we're drawing on expert info, right, from
Yes.
Canine Heartworm Disease Management.
That's our guide, yes.
Yeah.
Provides a really solid foundation.
Okay, good. So canine heartworm disease, the name kind of gives it away. Worms, heart. But let's break down the fundamentals. What's the actual cause here?
Well, the root cause is an infestation. It's a specific parasitic worm, Dirofilaria immitis.
Dirofilaria immitis. Okay.
But here's where it gets a bit more complex. The severity, how sick a dog gets, isn't just about the worms being there. It's influenced by, well, quite a few things,
Like what?
like the sheer number of worms, how long that infestation has been going on, the individual dog's immune system response that varies, and even the dog's activity level. All these factors sort of dial the severity up or down.
Huh. So it's not a one-size-fits-all disease, even with the same parasite. It's about the worm and the host reaction.
Exactly. And what these worms do, they cause damage, primarily to the inner lining of the blood vessels, the endothelium.
Endothelium, right.
This damage kicks off a whole cascade of problems. You get thickening and inflammation of the vessel walls. That's called myointimal proliferation.
Biointimal proliferation. Okay.
Yeah, basically think of the inside of a flexible pipe getting rough, stiff, and narrow. And then you often get swelling around the arteries too, making them even less flexible, hindering blood flow. Over time, the arteries can actually get enlarged, even tortuous, meaning twisted. It really starts to compromise the whole circulatory pathway, especially in the lungs.
Wow. So it's like throwing gravel into the plumbing system. It just gums everything up and puts pressure back.
That's a pretty good analogy, actually. These changes, these blockages, they directly lead to impaired lung function. The heart, specifically the right side, has to pump much harder to push blood through these narrowed, stiffened vessels.
Which leads to higher pressure in the lungs.
Precisely. That's pulmonary hypertension. And with that, you get an increased risk of blood clots forming thrombosis, which can be incredibly dangerous if they break loose.
Okay, that makes sense.
And what's really crucial, something people need to understand, is that the damage, especially to the lungs, can actually get worse even after the worms themselves are dead.
Really? After they're gone?
Yes, because the dead and dying worms trigger inflammation and can obstruct blood flow further as the body tries to break them down. And
Hmm.
any kind of exercise just puts additional stress on this already damaged system.
Man, it really does sound like a snowball effect. Okay, let's zoom in a bit. How specifically does it hit the respiratory system? You mentioned pulmonary hypertension.
All right, that's a major one. The high pressure in the lung arteries. And this directly contributes to the risk of thromboembolism. That's when those blood clots break off and travel, often lodging in the lungs and blocking blood flow. Very serious.
Okay.
Then there are some less common, but still significant respiratory issues. Things like allergic pneumonitis.
Allergic pneumonitis.
Yeah, it's basically an inflammatory reaction in the lung tissue itself, often triggered by the microfilaria, the baby worms, the larval stage.
Ah, okay.
And you can also sometimes see something called eosinophilic granulomatosis, which is another type of inflammatory lesion in the lungs.
So the lungs really take a beating, but it's called heartworm, so the heart must be under serious strain too.
Absolutely. That severe pulmonary hypertension, we keep mentioning it, puts a tremendous constant strain on the right side of the heart.
The side pumping blood to the lungs?
Exactly. And over time, that increased workload
Right.
causes the right ventricle, that pumping chamber, to enlarge and thicken. It's called right ventricular hypertrophy.
Right.
Like any muscle getting bigger from overwork, but not in a good way here.
Right.
And in some dogs, this can progress all the way to right-sided congestive heart failure,
Mm-hmm.
or RCHF.
RCHF. Okay.
And a classic sign of that is ascites. That's fluid buildup in the abdomen, making the belly look swollen. It happens because the heart isn't pumping efficiently, so fluid backs up in the body.
That paints a really vivid and worrying picture. What about other parts of the body? Does it affect, say, the blood itself or kidneys?
It can, yes.
Yeah.
In really severe cases, especially with a huge number of worms, they can physically block the major veins leading into the heart.
Mm-hmm.
This is a critical emergency called Caval syndrome.
Creutzfeldt syndrome. Okay.
This blockage is bad news. It can cause something called traumatic hemolytic anemia, basically.
Mm.
Red blood cells get damaged or destroyed trying to squeeze past the worm mass. And it can lead to cardiogenic shock, where the heart just can't pump enough blood to keep the body going. life-threatening stuff. And yes, the kidneys can be affected too.
Yes.
Sometimes the dog's own immune response to the worms leads to inflammation in the kidney's filtering units. It's called immune complex glomerulonephritis.
Immune complex glomerulonephritis. Got it. So it really can be a multisystemic problem. Just devastating. Which naturally makes you ask, which dogs are most likely to get this? Who's at highest risk?
Well, the really sobering fact is that in areas where heartworm is highly endemic, very common, essentially 100% of dogs not on preventative medication will eventually get infected. It's almost guaranteed.
100%.
That's stark.
It is. Geographically, the highest rates have traditionally been along the Atlantic and Gulf coasts and also in the big river basins like the Ohio and Mississippi.
Right, the warmer, wetter areas.
Generally, yes. But, and this is so important for everyone listening, heartworm disease has been diagnosed in dogs in all 50 states.
All 50. Even places like, I don't know, Alaska.
Yep. Because the vector, the mosquito that carries the larval worms, is incredibly widespread. Maybe not the same level of risk everywhere, but the risk exists pretty much anywhere there are mosquitoes and dogs.
Okay, that's a crucial point. No region is truly safe. Are there certain types of dogs more prone? Breed, size, lifestyle?
Well, the data suggests that medium to large breed dogs tend to have higher infection rates. Again, dogs that spend a lot of time outdoors, logically, have more exposure to mosquitoes, so they're at higher risk too.
Makes sense. Age, sex.
It can happen at any age, really, but it's most commonly diagnosed in dogs that are between, say, 3 and 8 years old. Probably just reflects cumulative exposure time. And there's a slight tendency for male dogs to be affected more often than females, though the reason for that isn't entirely clear.
Interesting. And it all circles back to mosquitoes and the right conditions for them, doesn't it?
Absolutely. Temperature is key. The mosquito needs certain temperatures for the heartworm larvae inside it to develop to the stage where they can infect a dog.
Okay. So it's not just about mosquitoes being present.
Right. You generally need prolonged periods, like a month or more, where the average daily temperature stays above 64 degrees Fahrenheit, that's about 18 Celsius, or alternatively shorter periods, maybe 10 to 14 days, where the daily temps are consistently above 80 Fahrenheit, which is around 27 Celsius. Those conditions allow the larvae to mature inside the mosquito, making transmission possible.
Okay, that explains the seasonal and geographical patterns, but also why nowhere is completely immune if conditions are right, even temporarily. So we know what it is, who's at risk, what should owners be looking for, what are the early signs?
That's the tricky part, especially early on. Heartworm can be really insidious. In mild cases, what vets call class 1, many dogs show absolutely no signs, or maybe just an occasional cough, something easily dismissed.
Okay, so easy to miss initially.
Very easy. As the disease progresses, maybe into class 2, as lung damage starts accumulating, you might notice that cough becoming more persistent. And maybe the dog gets tired more easily during walks or play. That's exercise intolerance starting to show.
Right, starting to see some impact then. And if it gets worse, into severe stages.
In severe disease, class 3, the signs become much more dramatic and harder to ignore. You might see noticeable weight loss. Even if the dog's appetite seems normal, that's called cachexia.
Cachexia.
They might become anemic, so their gums might look pale. The exercise intolerance becomes much more pronounced. Some dogs might even faint or collapse, especially after exertion that's syncope. And then you might see that abdominal swelling, the ascites, from right-sided heart failure.
Okay, so quite a progression from subtle cough to really severe illness. Those are things an owner might spot at home. What about when they go to the vet? What might the vet find on examination?
Well, again, in those early class-eyed cases, the physical exam might be completely normal. The vet might not find anything obvious.
Frustrating.
It can be. But as things progress, they might hear abnormalities when listening to the chest. Labored breathing, maybe crackling sounds in the lungs indicating fluid or inflammation. A faster than normal heart rate tachycardia. They'll note the weight loss, the cough, difficulty breathing, or dyspnea.
Dyspnea, difficulty breathing. Yeah?
And if that right-sided heart failure is developed, they might see the jugular veins in the neck pulsing or looking distended. They might feel an enlarged liver, hepatomegaly, when palpating the abdomen.
Hepatomegaly, an enlarged liver.
Exactly. And occasionally, though less commonly, a dog might actually cough up blood. That's called hemoptysis. And in those critical K-Val syndrome cases, the gums will likely be very pale, and the dog will be in obvious respiratory distress.
Wow. So a whole range of potential findings, but like you said early on, maybe nothing specific jumps out, which means diagnosis isn't just based on symptoms, right? You need tests.
Absolutely, because so many of those signs could be caused by other things. Other types of heart disease, lung disease, even cancer-specific diagnostic tests are essential. The first step is always differential diagnosis, thinking about all the possibilities that could cause those signs.
Ruling things out.
Exactly. Ruling out other lung problems, other heart failures, other parasites. That's step one.
And I assume blood tests are part of that workup. Can the standard blood panels give clues?
They can provide supportive evidence, yes.
Yeah.
Routine blood work like a CBC, chemistry profile, urinalysis might show things. Maybe some anemia, could be mild, could be more severe. Sometimes we see an increase in certain white blood cells, eosinophils and basophils, which can be associated with parasites or allergic reactions, but that's not a consistent finding.
Okay.
You might see signs of inflammation, maybe a low platelet count, thrombocytopenia, which could hint at clotting issues, sometimes elevated globulins, proteins related to the immune response.
Right.
In really severe cases, like with Cavill syndrome or lots of vessel damage, you might even see hemoglobinemia, free hemoglobin in the blood from damaged red cells. And protein in the urine, proteinuria, can show up if the kidneys are being affected by those immune complexes we mentioned.
So lots of potential clues in general blood work, but nothing that screams heartworm definitively.
Pretty much. They support the picture, maybe raise suspicion, but the definitive diagnosis comes from the specific heartworm tests.
Okay, tell us about those. What are the main tests?
The workhorse, the most accurate and widely used tests are serologic tests. These look for antigen-specific proteins that are produced by adult female heartworms.
Adult females only.
Primarily, yes. That's what the common antigen tests detect. And timing is important here. You generally want to test about 7 months after the mosquito season ends in your area,
Why 7 months?
because it takes about 6 to 7 months from the initial mosquito bite, the infection, for the larvae to mature into adults in the dog's body and start producing enough antigen to be detected reliably.
Ah, okay. That makes sense. So a negative test is pretty reliable.
Generally, yes. If the antigen isn't detected, it usually means no adult female worms are present. Sometimes if the test comes back as a weak positive, the vet will likely confirm it with a second test, maybe using a different method, just to be sure.
And what about a strong positive? Does that tell you anything extra?
It can, potentially. A really strong positive result might indicate a very high number of worms, or it could mean there's been a recent large die-off of worms. And that's actually significant because both scenarios could suggest a higher risk of complications, like those blood clots, after treatment begins.
That's really important clinical information. Now, what about looking for the microfilaria directly? The larvae in the blood. Is that still done?
It is, but it's not the primary screening test anymore. Tests for microfilaria are still useful, though. They might be used to confirm a weak positive antigen test, for example. Or, crucially, to check if a dog has circulating microfilaria before starting certain types of monthly preventatives, because some can cause a reaction if lots of microfilaria die off quickly.
Okay.
And they're also used to monitor dogs on preventative long-term, looking for any breakthrough microfilaria, which could potentially signal developing resistance to the preventative medication, although that's still considered relatively uncommon.
Got it. So antigen test is the main diagnostic tool. What about imaging? X-rays, ultrasound, can they show what's going on inside?
Oh, definitely. Chest radiographs, x-rays are really valuable. They let us see the heart and lungs. In a dog with heartworm, we might see enlargement of the main pulmonary artery, where the worms tend to congregate. The other arteries in the lungs might look enlarged too, maybe dilated and even appearing kind of blunt or pruned.
Pruned like a tree branch.
Yeah, sort of cut off abruptly. The severity of these changes on x-ray often correlates with how severe the disease is, from maybe no visible changes in very mild cases to really dramatic enlargement and vessel changes in advanced disease.
What else might you see on X-ray?
You might see cloudy areas or infiltrates in the lung tissue itself, especially around those enlarged arteries. If there have been thromboembolisms, those clots, these infiltrates can become quite widespread. And sometimes in dogs that are antigen negative but have microfilaria, that's called an occult infection, you might see a more diffuse, hazy pattern throughout the lungs, which suggests that allergic pneumonitis reaction to the microfilaria.
Okay, so X-rays give a good overview of the lungs and the big vessels. What about echocardiography, ultrasound of the heart?
Echo can give us even more detail about the heart itself and the major vessels right next to it. Again, in early stages, the echo might look totally normal.
Right.
But as the disease progresses, it can show things like the right ventricle being dilated and thickened, maybe the tricuspid valve isn't closing properly, signs of that high pressure in the pulmonary arteries. Sometimes the left ventricle might look smaller than normal because the right side is struggling so much.
Can you actually see the worms on ultrasound?
Sometimes, yes. And it's quite striking when you do. You can actually see the adult worms as these sort of bright, parallel, linear structures, sometimes moving within the chambers of the right heart or in the main pulmonary artery.
Wow, seeing them directly like that must really confirm things.
It definitely does. It provides direct visualization.
What about an ECG? The electrocardiogram, does that help?
Usually the ECG is normal in dogs with heartworm. It's not a primary diagnostic tool for this. However, in really severe cases, it might show electrical patterns suggestive of right ventricular enlargement or sometimes abnormal heart rhythms like atrial fibrillation, but it's not a consistent finding.
Okay. So it's really a combination approach, history, exam, blood tests, the specific antigen test, and then imaging like x-rays and maybe echo to stage the disease and see the extent of the damage.
Exactly. Putting all those pieces together gives the veterinarian the full picture.
All right, so once a dog is diagnosed and you have an idea of the severity, what's the treatment plan look like? How do you tackle this?
Treatment is typically multifaceted. The very first step, especially if the dog is showing signs of heart failure, is stabilization.
Right, get them stable before attacking the worms.
Precisely. That might involve medications like diuretics furosemide, usually to get rid of excess fluid. ATE inhibitors can help manage blood pressure and reduce the workload on the heart. Other drugs, like pimobendan or sildenafil, might be used depending on the specifics. Strict rest, usually cage rest, is vital, and often a moderately sodium-restricted diet.
Okay. What if the main issue seems to be the lungs, not heart failure?
If there are significant respiratory signs, oxygen therapy might be needed. Depending on the clinical signs and the X-ray findings, the vet might consider using anti-inflammatory doses of corticosteroids or potentially blood thinners like aspirin or heparin, although their use is sometimes debated. Again, stabilization is key.
Once the dog is more stable, then you go after the adult worms.
Yes, that's the core of the treatment.
Mm,
The drug used to kill the adult heartworms is called melarsoline dihydrochloride.
larcamine. Okay.
It's given by deep intramuscular injection, usually into the muscles along the lower back. The standard approach, recommended by the American Heartworm Society, is a graded kill protocol.
Graded kill. What does that mean?
It means you don't try to kill all the worms at once, which could cause a massive die-off and increase the risk of complications. Typically, it involves an initial injection, then a month of rest.
A whole month.
Yes, a month of strict rest. Then, after that month, 2 more injections are given, usually 24 hours apart.
Okay, so a 3-injection protocol spread out.
That's the most common one. For dogs that are smaller or have very severe disease or a suspected high worm burden, sometimes a slightly different protocol is used, maybe spreading the 3 injections out more, like one every 4 to 6 weeks.
And the rest part is non-negotiable.
Absolutely non-negotiable. Strict activity restriction leash walks only for bathroom breaks, no running, no jumping, no roughhousing, for at least 4 to 6 weeks after the final melarsoline injection is critical. Critically important.
Why is that rest period so vital?
Because as the adult worms die over the weeks following treatment, they break apart and travel into the smaller pulmonary arteries. The dog's body then has to break down and absorb these dead worm fragments. If the dog is too active, its heart rate and blood pressure increase, which can push these fragments deeper into the lungs, potentially causing severe inflammation or dangerous blockages, those thromboembolisms we talked about. Rest minimizes that risk.
Okay, that makes perfect sense. Kill the adult slowly, rest the dog strictly. What about the microfilaria, the larvae? Do they need separate treatment?
Yes, they do. Usually, eliminating the microfilaria is done using monthly heartworm preventatives, the same kinds used for prevention, often starting around the same time as or shortly after the adulticide treatment begins. Sometimes antibiotics like doxycycline or minocycline are given concurrently or beforehand.
Why antibiotics? The worms aren't bacteria.
Good question. It's because heartworms harbor bacteria within them, a specific type called Wolbachia.
Blachia, living inside the heartworm.
Exactly. And these Wolbachia bacteria are thought to contribute significantly to the inflammation and immune reactions seen in the dog's lungs and kidneys, especially when the adult worms die. So treating with doxycycline or minocycline kills off the Wolbachia, which seems to reduce the severity of the inflammation after the melarsoline treatment and may even weaken the adult worms slightly.
Fascinating. So antibiotics help manage the fallout from killing the worms.
That's the idea, yes. And regarding the microfilaria themselves, using the monthly preventative clears them from the bloodstream. You do want to be a little cautious, as an experienced surgeon can use specialized forceps or snares, usually inserted through the jugular vein in the neck, to reach down into the heart and vena cava, and physically extract the massive worms.
Yeah.
We could be life-saving in those situations.
Wow. That sounds intense, but necessary. Are there dogs for whom the standard adulticide treatment, the melarsoline, just isn't suitable?
Yes. It's generally considered too risky for dogs that already have significant kidney or liver failure, or a condition called nephrotic syndrome where they're losing a lot of protein through their kidneys. The treatment itself could worsen those conditions.
So what happens for those dogs?
It's a difficult situation. Management might focus on addressing the underlying organ failure and potentially using the monthly preventatives and doxycycline long-term, sometimes called the slow kill or soft kill method, but it's not ideal.
You mentioned that slow kill method before. Can you elaborate? Why isn't it ideal?
The slow kill approach typically involves long-term administration of a macrocyclic lactone preventative, like ivermectin, often combined with doxycycline. While it can eventually kill adult worms over a very long period, potentially many months to years,
Years.
it can take that long, yes. And during that entire time, the live worms are continuing to cause damage to the heart and lungs. Plus, there's a significant concern that exposing worms to low levels of these preventative drugs for such extended periods could contribute to the development of drug resistance.
Making the preventatives less effective down the line for other dogs.
That's the worry. So while it might be a last resort in specific cases where melarsoline isn't an option, the standard adulticide protocol is strongly preferred because it eliminates the worms much faster and stops the ongoing damage sooner.
Makes sense. So treatment is complex, requires careful staging and planning with a vet. What happens after treatment? How do you know it worked?
Follow-up is definitely key. The standard recommendation is to repeat the heartworm antigen test about 6 months after the final melarsoline injection.
6 months later, to confirm they're gone.
Yes, to confirm the adult worms have been successfully eliminated. Sometimes a dog might still have a persistent low-level positive antigen test result even after treatment.
What does that mean? Did the treatment fail?
Not necessarily.
Yeah.
It often means most of the worms were killed, but maybe a few fragments or a tiny amount of antigen remain. In many cases, if the dog is kept consistently on year-round heartworm prevention, this low-level positive will eventually clear over time without needing more melarsoline. The vet will assess the individual case, of course. The lung damage should still gradually improve.
Okay. And all through this, prevention seems like the underlying message. We keep coming back to it.
Because it's so important. Prevention is vastly safer, easier, and cheaper than treating heartworm disease. Year-round prevention is the gold standard recommendation for all dogs considered at risk.
Which, as you said, is pretty much all dogs given mosquitoes are everywhere.
Basically, yes. If year-round isn't done for some reason, then prevention should absolutely start before the mosquito season begins and continue for at least a month after the first hard frost.
And testing before starting is crucial.
Essential. You must test a dog for heartworm before starting a preventative, and then test annually after that, even if they're on prevention year-round.
Why test annually if they're on prevention?
It's a safety check. No medication is 100% effective 100% of the time. Maybe a dose was missed, maybe the dog spit out a pill, maybe there was some issue with absorption, or in very rare cases, maybe potential resistance could be a factor. Annual testing confirms the dog is still protected.
Right, a backup check. What are the main preventative options?
There are several excellent options, usually based on drugs from the macrocyclic lactone class. Common ones include ivermectin, milbemycin, moxidectin, and selamectin.
And they come in different forms.
Yes, you can get monthly oral tablets or chewables, and also monthly topical solutions applied to the skin. There's even an injectable form of moxidectin that provides 6 or 12 months of protection, depending on the product. They can usually be started in puppies as young as 6 to 8 weeks old.
So lots of choices to discuss with the vet. You mentioned resistance briefly. Is that a major concern with preventatives?
There have been some reports and studies suggesting reduced effectiveness or potential resistance in certain heartworm populations in specific geographic areas, particularly in the Mississippi Delta region. However, widespread resistance is not considered a major problem currently. Consistent use, ensuring dogs get their doses correctly and on time, and managing infections promptly if they do occur are the best strategies. Ensuring dogs are cleared of microfilaria is also part of managing that potential risk.
Okay, so consistent prevention, guided by your vet, remains the absolute best defense. Now, going back to treatment, what are the main complications owners should be aware of after the melarsoline injections?
The biggest one, as we discussed, is pulmonary thromboembolism, those clots in the lungs. The risk is highest in the weeks following the injections, usually peaking around 4 to 6 weeks after treatment, especially if the dog had severe disease to begin with or if activity wasn't properly restricted.
Strict rest really is key then.
Absolutely critical. Other potential issues can include temporary drops in platelet counts, maybe some other clotting abnormalities, and the injections themselves can cause side effects.
Like what?
Localized pain, swelling, or soreness at the injection site is pretty common. Some dogs might seem lethargic, lose their appetite for a bit, or maybe vomit. Rarely, more serious reactions like elevated liver enzymes or even neurological signs have been reported, but those are uncommon.
Okay. And wrapping things up, what's the general outlook, the prognosis for a dog diagnosed with heartworm?
It really depends on the severity, the class at the time of diagnosis. For dogs with mild disease, class 1, the prognosis with proper treatment is generally excellent. They usually recover very well.
That's good news.
It is. However, for dogs with severe disease, class 3, especially those already showing signs of heart failure or significant lung damage, the prognosis is much more guarded. They have a higher risk of complications during and after treatment, and recovery may be incomplete. Early detection and treatment make a huge difference.
So the big takeaway here seems pretty clear. Heartworm is serious, potentially fatal, but it's also very treatable, especially if caught early, and most importantly, it's highly preventable.
That sums it up perfectly. Early detection through annual testing and consistent year-round prevention discussed with your veterinarian. Those are the absolute cornerstones of protecting dogs from this disease.
Yeah, that ongoing conversation with your vet seems critical, doesn't it? For testing, prevention choices, treatment if needed.
Absolutely vital. Every dog's situation, their health status, their lifestyle, the specific risks, and their geographic area, all that needs to be considered for the best plan.
Right. So, considering how widespread mosquitoes are and how serious this disease can get, it really prompts a question for everyone listening. What concrete steps can you take starting today to make sure your own dogs have that reliable year-round protection? And based on what we've discussed, what specific questions should you be asking your vet at your next visit? Definitely something to think about.
Crucial questions indeed.
Thanks for taking this deep dive with us.